aged about 20 years and 2 seconds at that moment, but I'm grateful to have that opportunity. Let me just speak to a couple of other issues, because I know we want to take questions or comments. But I wanted to talk for a moment about the question that Dr. Ismail and others have raised about visa denial and the delay in medical professionals even after they've secured residency in the United States. I don't have a 2-minute solution for you, and I don't have a soundbite in case anybody was expecting that. It's a problem we've got to work on, and I want you to know that I'm going to do everything I can through our office, working with the State Department, but also other agencies as well. We've got, when it comes to a question like that, it involves a number of federal agencies, and we will do everything we can to try to be more responsive. And I know that I can't say that I know. I can only say that I'll try to understand better how difficult that is, because that's never happened to me. Never had that experience. The worst experience I've had was not that bad at all. You go through the metal detectors and the security, and sometimes when I was campaigning, because we switched our airline reservations at the last minute, you automatically go into a different category. So they would pull you aside and they'd frisk you and do all that stuff. That wasn't too bad. I've never had to go through what you've been through, but we'll certainly spend some time in that and see if we can't help. I don't promise things like that, because I can't promise that it'll be changed anytime soon, but we'll certainly work on that. I mentioned aid to Pakistan, and I know I'll tell you a quick story about my visits to Pakistan in a moment, but before I do that, I do want to address a little bit on health care. We passed, as you know, the Affordable Care Act in March of 2010. As many people in this room know a lot better than I do, because you're living with the beginnings of this bill, the early provisions that have been implemented. Some provisions will be implemented in 2011, 2012, 2014. And I know as citizens and as physicians, you've got some concerns about it. Number one, I would say that one of the best things we did in that bill was a whole set of reforms to make sure that Americans with insurance don't have to worry as much as they did before. There's no reason why in this country, and that's why when folks were saying that we ought to repeal this legislation in total, way back in the first part of this year, one of the answers I gave to that was we should do that for a number of reasons. One of the reasons is we cannot go back to a time in the United States of America where a child is denied coverage or treatment because of a pre-existing condition. We should never allow that to happen again in this country. We should never again allow what has happened to a lot of families in Pennsylvania and across the country to be denied coverage arbitrarily, or to have imposed upon them lifetime limits on their treatment or their care. So I think there are a number of changes that were made that have already begun to go into effect that I think a lot of Americans are happy about. I think we also finally, in this legislation, did something that small businesses were saying to us for years. Small businesses were coming to Washington year after year and saying to Democrats and Republicans, please help me as a small business owner be able to afford health care coverage for my employees. I want to do it. I want to provide that coverage, but I can't in the current system. So what we did was we passed it as part of the legislation, a tax credit. The first year it went into effect in 2010, it was a 35% tax credit. That will go up to 50% of a tax credit. That's helping lots and lots of businesses here in the Commonwealth and across the country. We don't know the exact number yet, because of course in April we'll see the tax returns. But I want to make sure that every possible advantage could be taken of that provision for small businesses, so they have the opportunity to provide coverage for their for their employees. There are, I think, a lot of concerns about Medicare and what will happen with Medicare. I think what the bill did, and I'll be very brief about this, but I want to take more questions, but what the bill did was to try to focus on making sure that we are helping, providing even more help to folks on Medicare. First of all, to guarantee Medicare benefits. I know there are a lot of television ads this year in 2010 that got me pretty mad because they were deliberately misleading about Medicare. What the bill did was guarantee that if you get Medicare, you get traditional Medicare, your benefits are guaranteed under the bill. That's point number one. Point number two, prevention. Why should someone on, for annual checkups and prevention, why should someone on Medicare have to pay for that? We're finally providing, as a result of this bill, those kinds of visits at no cost. That makes a lot of sense. We also wanted to make sure that Medicare is going to be there for future generations. And that's going to, some of the provisions in the bill that begin over time to control costs are going to be very, very important to preserving Medicare. You know, I hear a lot of folks in Washington preach and preach about the deficit. They say the deficit has to be reduced, and I agree. And we have to cut spending. I agree with that. And we're going to cut spending, and we're going to reduce the deficit, and we're also going to get control of our debt. But you cannot do that. You cannot do that with just the 12% of the budget that you hear talked about in Washington. We've got to make sure that over time we're doing everything possible to control costs. And you can't begin to tackle the deficit until we get control of health care costs. And we won't know whether or not that's working perfectly for a while yet. But we're going to work very hard to make sure that we're doing just that. I would say finally, when it comes to health care, we wanted to make sure that we're doing everything possible to provide more access to care. We wanted to help the 15 or so percent of the American people who had, or I should say the 85% of the American people who had health care but didn't have basic protections. I mean, why would we tolerate someone why would we tolerate a situation in this country where someone was paying their premiums with coverage for themselves and their families, and then they're told, oh no, we forgot to tell you that child with a pre-existing condition doesn't get coverage. So we were focused on helping and strengthening health care for those who had it. We were also aware, as we were trying to fight to pass the bill, that about 15% or more of the American people, millions and millions of them, had no health care at all. And listen to some guys in Washington, you would think that none of us were paying for that. We were. Someone doesn't have health care and they go to the emergency room, we all pay for it. That wasn't good for them because they were getting treatment too late, and it was bad for the rest of us because we were paying for it. But there are a lot of people in Washington who said, that's fine, just leave it the way it is. Let 30 million people or more than 30 million, go without health care coverage. No problem for me because I have health care coverage. And they were dead wrong. It was bad for the people who didn't have coverage, but it was bad for the rest of us because we're all paying for that in our own premiums. So we finally covered, not every American who didn't have coverage, but we finally covered more than 30 million Americans in this bill. They're not covered yet. It's going to take a number of years to do that. So that's kind of a quick review of the bill, but it was very important, I think, that we finally, at long last, made progress on both access to health care and doing everything possible to improve the quality of care, and also to begin to wrestle with some of the basic costs of health care. Let me conclude with one thought. Two thoughts, really. One, the first thought